Why is healthcare in America so expensive? Really? Remember that classic question in philosophy? If a tree falls in the forest and there is no one around to hear it, does it make any noise? Well, I would pose a similar question aimed at today's headlines. If Medicare and Medicaid had never existed, would healthcare costs in America be more or less or about the same? As the nation contemplates some sort of government-controlled healthcare, with a major goal of controlling cost, we must get the answer to this question right in order to know if the government prescription for controlling cost is going to work. I'll come back to the answer later, but first let's examine some of the explanations already offered as to why healthcare costs in America are so expensive. Is it because of unscrupulous doctors performing more lucrative medical treatments than necessary out of greed, as our president would have us believe? No, I really doubt it. Then how about greedy insurance companies charging the highest premiums and paying out the lowest benefits? I'm sure that's part of it, but that doesn't begin to answer the question. Well then, it must be the lack of competition between insurers because of legal barriers preventing coverage across state lines. No, that's not it either, but it probably contributes around the margin. Okay then, it's got to be the high cost of medical malpractice insurance, along with the defensive medicine doctors must practice as a result. That's not it either, although that is a significant contributor to cost and warrants addressing. Then surely it is because the U.S. has the highest level of medical care in the world, thanks to technological advancement, MRIs, laser surgery, life-prolonging drugs, and the like. Now that makes economic sense. But no, that's not even it. Folks, the answer is this in a nutshell. Medical care and insurance is so expensive in the U.S. because it is the only consumer good or service that a majority of Americans consume without first knowing or asking what the cost of those services are. In contrast, we all want to know the price of a home or a car before we buy it, so why not healthcare? Well, it has to do with the way our system is structured. Most Americans are insured either through their employer or through the government, and all they would typically know about the cost is how much their employer or the government deducts, if any, from their paycheck or Social Security check as contribution toward that cost. As an example, I once worked in corporate America, and frankly, I did not know or care what my employer actually paid for my medical care and insurance because I was not footing the bill. So there was no direct incentive on my part to control that cost. In contrast, let's look at an incentive-based system, using my own current situation as an illustration. I am now a self-employed business owner, so I am one of the minority of Americans who actually go out into the free market and purchase and pay for my health insurance directly. So naturally, I ask the cost before I purchase, and I structure my insurance package to achieve the best coverage at the lowest cost. So what is the result? Mine is a catastrophic plan with a $10,000 deductible costing $1,800 per year. So when I hear in the news about these union and executive Cadillac health insurance plans costing $13,000 a year, frankly, I can hardly believe my ears. I guess I could purchase one of those plans that covered routine eye and dental care, along with treatment for the owie on my finger. But here's the difference. I'm the one that has to pay for that plan, so obviously I choose not to. Now, you can call that buying choice a lot of things, but when it gets right down to it, it is a form of self-rationing. That's what most consumer buying decisions are. Choosing a Chevy over a Cadillac, or a 3-bedroom home over a mega mansion is self-rationing. That is how the free market works. On the other hand, any time that a good or service is offered whereby the cost of that good is either hidden, shifted elsewhere, subsidized, or provided free, then that removes the process of self-rationing. So in its absence, one of two things must happen. Either costs become very expensive, or else in this example, the corporate employer or the government has to ration care. So, back to our original question. If Medicare and Medicaid had never existed, would healthcare costs in America today be more or less or about the same? Well, of course the answer is that healthcare costs would be less, much less today. Because Medicare and Medicaid fall in the category of a consumer good that is subsidized and provided free, respectively. Putting aside for now whether or not this is good government policy, the only point that I would make is that if the government proposed reform of healthcare continues this subsidy and provision of free care, then there are only two possible outcomes. Either costs continue to dramatically increase and even become uncontrollable, which is probable in a political environment, or the government has to ration care. Just like I practiced self-rationing in order to control my personal health insurance cost. In this environment of supposed desired transparency, let us, and more particularly our government, at least be honest about this. It should now be clear that another way to control healthcare costs is to substitute government rationing with self-rationing, where those who receive the benefits are the ones who pay for those benefits, and in an amount consistent with the value of the benefits received. So the best reform, in my opinion, is to move toward a system where consumers buy their own insurance and make personal decisions about how much they want to spend on health care and what services they would pay to have performed, and so on. Self-rationing is better than government rationing any day. So this is what would really control healthcare costs in America. Really. Thank you.